should I have IVF before surgery for endometriosis or after? This is probably one of the most challenging questions in the field of endometriosis. And the answer, like most other questions in this field, is it depends. And every person is different, and our job is to consider your particular circumstances and decide what the options are and which one would be better for you. The problem is that we know the presence of endometriosis does affect the outcome of IVF. There are even some studies that suggest that removal of that endometriosis may improve the outcome of the IVF, although these studies really need to be repeated and the results should be confirmed in further studies. For that reason, I don't advise surgery if it is only to improve the chances of success for the IVF. But there are situations in which that may not be such a bad idea. So for example, if there is hydrosalpinx or hematosalpinx, so if there is a problem with the fallopian tubes, that could be very important in the outcome of IVF, and normally fertility specialists will ask me to remove the fallopian tube that is affected. Or in situations where multiple rounds of IVF have failed, sometimes we decide in our multidisciplinary team meeting that it would be good to then remove the endometriosis and see if that offers any improvement. And that's sometimes what we do. Sometimes the ovaries may not be accessible for IVF, so we need to do surgery before IVF to mobilize the ovaries or to treat the endometrial cysts, endometriotic cysts, before IVF is done. So every person is different, and this is something that we should really carefully discuss, consider, and then decide together.